I use that perspective all the time when it comes to today's technology. It's not all bad. We rely on technology like GPS, a little guidance to get us somewhere, right? My anxiety is decreased when I look at Waze and I see it's 5 minutes of traffic. That helps my anxiety decrease. So when it comes to guidance and perspective, our youth rely on GPSs every day. So I ask adolescents and families just to think about perspective to navigate this road in this marathon.
In this episode, we're unpacking teen substance use and navigating conversations about drugs and alcohol with your teens.
One of the conversational pieces that I look at from a non-shaming, non-blaming way is to ask invitational questions around their behavior. Less blaming, less pointing fingers, and more invitational, more I'm noticing, I'm seeing, and I'm curious if you are worrisome about these behaviors.
Welcome to the Speak Up podcast, where we share what we've heard and learned over the past 25 years, working with over 35,000 youth and families. Our mission is to build a community of support around young people. We're here to foster communication and help parents relate in ways that make teens feel heard and seen so they can thrive. So let's embark on this journey together as we uncover the keys to empowering the next generation. Welcome to the Speak Up podcast. I'm Marty Berniker, the Executive Director of Speak Up. This episode is brought to you by our friends at the Uncommon Individual Foundation, UIF, a catalyst for change through mentoring. UIF's ONTRACK Plus software is transforming the educational landscape for underserved students by creating pathways to college credits and scholarships. Discover more at uif.org. In every Speak Up encounter with teenagers, there's always a voice that captures the thoughts and feelings of countless others. Their words stay with you long after. Let's listen to one of those voices now in our Teens Tell Us moment.
You want to make your parents think you are doing fine and that you are happy, and you don't want them to worry.
Today, we are speaking with Michael Blanche, co-founder and chief clinical officer of Ethos Treatment in Greater Philadelphia. With over 2 decades of experience as a licensed clinical social worker, Mike specializes in providing direct clinical treatment for individuals grappling with dual diagnoses of addiction and psychological issues. Beyond his clinical work, Mike is a renowned expert in prevention, focusing on middle and high school prevention talks and staff development, and workshops covering various topics, such as technology impact, process addiction, and dual diagnoses. Mike offers invaluable guidance to individuals and families in navigating challenging situations to determine the most appropriate level of care or placement. We're delighted to have Mike Blanche here today to share his insights and experiences. Welcome, Mike.
Thanks, Marty. Really appreciate the opportunity to be here today.
Mike, I think it's always helpful to start with the current context. Can you tell us a little bit about what you're currently seeing in terms of teen substance use, misuse, or abuse, and also about some of the process addictions that you're seeing?
First, when it comes to understanding the current context, I'll give some back history. The back history is the last decade of our work has been really kind of seen as the opiate epidemic appropriately got the press in the city of Philadelphia, the greater U.S. We really saw the impact of heroin. Opiates were pervasive in our culture and appropriately got the press. What's happened, though, underneath that surface in the last decade has been the alcohol uprise as well as cannabis culture. During the pandemic, at the height of the pandemic, which had a significant impact on addiction and mental health issues in our communities, what happened was when bars were closed, nightclubs were closed, places where establishments that you would classically buy alcohol on a regular routine basis, when all those places were closed, alcohol sales went up 15%. And that was in 2021. It only got up further in the following 2 or 3 years. So alcohol is such a pervasive in our culture. And what has happened is adolescents following what parents are doing. So more parents are drinking at home by themselves without any monitoring. So we're seeing an uprise of alcoholism and alcohol problematic behavior. So kids are seeing it and thinking it's no big thing. So alcohol prevalence is a part of parent permissiveness. That's a part of what has been happening in the last 3 to 5 years. The other big thing is cannabis culture and the minimization of cannabis, the minimization of marijuana, the misinformation around medical marijuana. And I use air quotes to say that there are diagnoses that are researched, 3, in the state of Pennsylvania, that you can get a medical marijuana card for versus 37 other diagnoses that you could get a medical marijuana card are not researched. So there's a lot of minimization of cannabis. And the other big consideration when it comes to marijuana and the minimization of it is so many parents think it's no big thing. I smoked a little pot in the 80s. And again, I'm not a prohibitionist, but when it comes to adolescents, they don't understand, and parents don't understand, that the THC content in marijuana in the 80s and 90s was like 4 to 5% THC content versus today is much more acute. And I can get into that in later discussion. One of the considerations you asked about in our discussion in preparation for today was around technology and how technology's just been a part of our world and a part of our life. But before I even start talking about technology addiction, I want to warn parents and talk to parents directly to say, I really want parents to be conscious of how they're talking about this topic, because I was raised in a home where my parents were really afraid of that rock and roll music was going to make me do drugs and alcohol, right? And so I want to avoid a clinical term called fuddy-duddyism. And for those people that aren't aware of what fuddy-duddyism means, it means I don't want you to be an old fuddy-duddy. And we were talking with parents earlier today where we talked about how the parent was coming off too strong, blaming technology for their adolescent's mental health, and it got more of a power play. So technology has taken off. It's in our culture. And again, I'm not a prohibitionist when it comes to technology, but I want parents to be informed. I want adolescents to be informed so they can make a better conscientious choice around this, as opposed to all of a sudden these algorithms and what's behind the technology that we can get into as well.
So as a parent, that's a strategy that I have found very helpful that you've talked about, which is I just want you to be a conscientious consumer and to message to our young people that we believe that given good information, that they will make smart decisions. And so then the question becomes around, well, where are they getting their information and what information are they getting?
Absolutely. And where are they learning from? And who are they learning from? Is it other friends online? Is it other sources on technology? So again, the term that I'll say many times today is that I'm not a prohibitionist. I'm not anti these technology pieces or alcohol or substances, but as a prevention specialist, I'm all about informing our youth and giving them the right to choose, as opposed to the algorithm behind technology. The algorithm behind TikTok is such an allure and such an addictive culture that they want your kid to be on their device much more than we want them to be on their device.
And you talked about gambling as well. Can you say a little bit more about what you're seeing with that?
So when it comes to gambling, so many of our folks think of that elder person at Atlantic City in a casino establishment. But with today in our world, it is in our back pockets, because now you can download them without any supervision, without any clarification on how old you are. So you can bet at a very young age if you have access to a credit card. And you can directly bet on your device instantaneously without much monitoring. We have 2 centers at Ethos Treatment where we have a treatment for gambling disorder, and it has taken off the need for gambling treatment because of so many of our folks are young adults and adolescents gambling their savings and gambling their parents' credit cards, gambling with their parents' credit cards.
Thank you. When we were growing up, we had the talk, the sex talk, the drug talk, etc. But now we know it's less about the talk and more about the ongoing conversation. What are some tips for parents to have these important conversations, how to do it, and how to help keep their teens safe?
That's a fantastic question. And the best way to know how to frame that before I get into the specifics is look at adolescence and look at young adultness as a marathon and not a 100-yard dash. And please, I ask parents to think about to not put pressure on themselves that they have to have this one conversation once and do it perfectly. Please don't put pressure on yourself. I beg the parent to know that it's a multitude of micro conversations that they can have throughout their adolescence, and to look at a channel of communication to be inviting, to be inquisitive. And the Columbo approach is one of my favorite approaches where, I just want you to be curious and ask questions to get a child or a young adult to talk through whatever they're thinking about, and in a non-judgmental, non-shaming, or non-blaming way, have a conversation that's more invitational and more conversational, as opposed to a parent-child, I'm going to tell you what you should do. And I'd rather you as a parent sit with your child and talk with your child. It's about timing. It's about when and where. Some youth I'll talk to say they're afraid to have that talk when they're in a vehicle because they feel trapped, or they feel like, oh, I just needed to get a ride. And some parents are going, great, I have 30 minutes in a car all by herself, so I'm going to rattle through this. And you're stressed driving and the kid is stressed because they feel, so that, I don't know if this is the best time of day. So many of our parents say, oh, great, they're home, I'll get them before they go off to school. And the child may be thinking 100 things before they're walking out the door. When, where, and preventatively, before we get to a weekend, before we get to a Saturday night, or before we get to that really difficult conversation the next day. So being upfront, being all about in front of conversations, and having multiple conversations around substance use disorder. If it is in your family of origin, for instance, if mental health issues are in your family of origin, or if medical issues in your family of origin, it's really important to talk with your child before, so that they're informed about what their genetics are.
Can you talk about some of the other risk factors related to how substance use can turn into addiction?
I'd like to reframe that in the respect of prevention, and just so often prevention's misunderstood. I see Speak Up as such a great prevention resource, and I can't thank you and your family enough for what you've done. Because what prevention does, and the definition of prevention that I like to mention, is decreasing the severity and the significance of an impact of mental health or substance use disorder, as well as to also put out there that help is available. When I first started talking in prevention, I would have to talk a lot about therapy as an option and decrease the stigma around asking for help. Now kids are talking about their therapists. Now kids are more open and receptive to receiving outside help and therapeutic intervention, which is amazing, which I'm so grateful for. So the other aspect of prevention I'd like to mention, when I talk with adolescents, and I'm talking directly to your kids now, I'll say there's two parts of prevention, is to know yourself and to know your environment. And when I talk about to know yourself, this gets to that specific question around what are some of the factors that we look at. I ask kids to think about, if you know addiction or substance use disorders in your family of origin, that's a big one. If you know that mental health issues are in your family of origin, that's another big one. And if you know that you have some medical complications or some neurologic issues, or if you're on medications, that's a big one, because certain medications will affect tolerance, certain medications will affect use, and certain medications will affect misuse. So know yourself is to also know if you've had a stressful week, if you're not drinking fluids, if you haven't been sleeping that well, if you're sick. So many of our youth try to keep up with somebody their same age, their same height, their same weight, and they think they'll have the same amount of drinks than their friend that looks about the same weight and height, but their brains are different, their sleep patterns are different, and it may affect them dramatically different. So know yourself is also to know some of those risk factors like sleep, food intake, or even just simply dehydration. Alcohol is a significant dehydrant to your system.
I remember something you had said to me that I did not know, and it was really helpful, and I've passed it on, was the idea of those concerts, So when you go to a multi-day concert, people don't think about that the second day, some of the alcohol from the first day is still cycling in their body.
Correct.
And so that can affect your tolerance and how much you can drink and how risky your environment.
Absolutely. In that respect where, alcohol and substances have a cumulative effect. So alcohol has a half-life, so it stays in your system for up to 36 hours. So the dehydrant value and how it affects sleep the next day. So 100%. So 2-day concerts, that mystical Made in America concert we were up against for a long time in the Philadelphia region, so many of our youth got in trouble the second day as a result of that. Yeah.
Thank you.
Yep.
So one of the things that we're hearing related to weed is young people saying, you mentioned earlier that they say, it's not as bad as XYZ, but also they will often say that it's not addictive. Can you talk a little bit about that?
That's a great question. So many of our youth, so many of our parents don't understand that absolutely cannabis is addictive, can be addictive, not for everybody, but there are clear factors that we look for when it comes to addiction. There are criteria for addiction. And in what's called the DSM-5, which is kind of our go-to manual, it's literally called the manual for mental health providers, cannabis dependency is in that. And one of the factors that we looked at is cannabis withdrawal. If you need to go through withdrawal from the substance, that's kind of a sign that you have an addiction to it. So one of it is difficulties with sleep, irritability, agitation, and anger, difficulty with thought process, and flu-like symptoms are some of the withdrawal signs of cannabis. Another factor when it comes to addiction of cannabis is increased tolerance. So some kids may need more of that substance to get the same effect. And so kids build a tolerance if they're smoking on a daily basis, if they're exposing themselves to a daily basis of the substance. So they're smoking much more and more. We see this a lot with alcohol. It's easier seen with alcohol, but increased tolerance happens with cannabis as well. Some of the other factors are using despite adverse consequences, knowing that their parents or their schools or their teams or their sports might drug test. They're still smoking despite knowing that's an option. Or the mental preoccupation with it. So they're preoccupied with it when they're going to go, how much will they be able to smoke when they get somewhere. And that mental preoccupation is a factor of addiction. Does that answer that question?
Yeah, that's helpful. Okay. I appreciate that.
Yeah.
So, Mike, you mentioned earlier about weed being one of those generational gap issues, and you talked about how the weed of today is different than weed that adults may have smoked when they were younger. Can you talk a little bit about the specifics of that related to THC and some of the delivery mechanisms and how that affects the impact of the drug?
100%. And again, it is our biggest generational gap. I really do believe, beyond technology, by the way, is this idea that cannabis, we have to ask in our formats of when we're doing an evaluation, what format you're ingesting the substance called cannabis. In the 80s, it was more like 4 to 5% THC content in the plant. And nowadays, it's anywhere from 25 to 35% THC content in the plant. So that's the normal exposure rate. What we think of with cannabis is rolling up a marijuana joint or smoking it in a device. However, now they have concentrates. Now they have ways to extract the THC content and putting it into vape products, and vaporization of that product gets to liquids, dab pens. The other term is vape pens. And those are more like 95% THC content. And then when we talk about edibles are varying ranges. There are certain states like Colorado, for instance, one of the original states that legalized marijuana. There's a bill this year to reevaluate edibles because there's so many different aspects of edibles. There could be 5 milligrams, 10 milligrams, 20 milligrams. And what is the recommended dose of a gummy bear of cannabis sometimes is a third of the gummy bear. How many people just have a third of a piece of chocolate? How many people in here have one chip? Usually you have 2 or 3 chips, right? And our youth don't listen to specifics and directions. They'll eat an edible and then they won't feel the effects. Well, when you eat an edible, it has a delay impact. It takes time for its full effect. So many of our youth, think about adolescents, they don't have that patience to think about how it's going to affect them. So guess what? Then they take 2 or 3 and then it's full on effect. And that's where the concerns around the mental health pieces with cannabis. We're seeing an uprise of psychiatric issues. We're seeing an uprise with psychotic features. And that's just primary with cannabis exposure.
Thank you. Mike, what are the signs that our teen might be using substances, and what can we do when we notice them to help keep our kids safe?
Those are two great questions, and the first is to when we what do we look for? What do we see? I don't want you to miss the obvious, or I don't want to step over the obvious, because when it comes to smells or hygiene or self-care, that's one of the first indicators that I look at. And when it comes to your home, you have every right as a parent to evaluate your home, what's in your home, what's in their room, or their vehicle is your vehicle a lot of times. So don't be afraid to have a conversation if you're worried about a big one is dropping grades, a shift in friend group, an over kind of obsessive with culture of aspects of using substances. And so looking for those obvious things could be an answer. But again, this ties into your second question there, not being afraid to have that conversation, not being afraid to ask the question. And one of the conversational pieces that I look at from a non-shaming, non-blaming way is to ask invitational questions around their behavior. And what I mean by that is less about you're doing this, less accusatory, less blaming, less pointing fingers, and more invitational, more I'm noticing, I'm seeing, and I'm seeing these behaviors, and I'm curious if you are worrisome about these behaviors.
Yeah, that was so helpful. We talk and speak up about one way to start any conversation on a tough topic is to say what you see. So that's kind of how we reference it. And I remember being concerned at one point, and you said to say to my child, "Hey, I noticed this, I noticed that individually, maybe not as big of a deal, but I'm concerned. Are you concerned?" And to genuinely ask that question. And you had said, well, they'll probably say that they're not. And if they do, then to follow up with either like, what would make you concerned? Or do you promise that you ever are concerned that you know you can come to me to talk about it? And that was such a helpful guidance that you provided. And I've used it for this conversation and many different conversations on different topics as just an effective way of communicating with my then teenagers and now young adults.
And it's just concern. It's not blaming, it's not accusatory. It's just a curiosity, a question of, have you ever been concerned? Or has any of your friends ever been concerned about your behavior? Has anyone else thought about if I was to poll some of your friend group on a Friday night, how do they think your behavior is while drinking or using substances? And again, identifying the behavior and less about the person. And maybe that behavior we can shift, pivot, and reevaluate that behavior.
So at Speak Up, we talk all the time about non-judgmental conversation and how they really don't want to worry us. They don't want to burden us. They really don't want to disappoint us. And one of the things that they say that stops communication is they don't want to be judged. And I remember one of the therapists that we work with saying the opposite of judgment is curiosity. And that was so helpful to me. And when I hear you say, like, ask questions, it's a fine line because young people will talk about the parents when they're the interrogator. So what we often say is to just really be in the spirit of wanting to understand. And so phrases like, help me understand, we have found to be a useful entree into that conversation as well. But you really need to be in the mind space where you genuinely want to know and understand, because they can tell if a question is really just a statement that you're trying to make. And we've heard that from a lot of students in Speak Up.
I get the opportunity to supervise therapists and look after therapists at Ethos Treatment and other places. And I recommend all therapists to work with adolescents first. Adolescents challenge us. They're the best at reading a room. They're best at making sure that we're being our authentic selves. So I ask parents to really challenge yourself when you're going into these conversations to be authentic and real, because a kid is going to pick up on that. A kid is going to react to that. And that's where we don't want to come with a secret agenda. We really do want to be curious.
Thank you. One of the things that you've said that's been useful to me as a parent and as a Speak Up leader is this idea of noticing patterns. So you mentioned earlier about it not being a marathon, this idea of this is a journey that we're on with them, and then looking at pattern behavior. So can you say a little about that?
Thank you for bringing that back up, because this gets to your question too about what to look for in signs and symptoms if you think your child has a problem. A lot of times we don't want to look at just one event or one issue as the issue. We want to look for a pattern of behavior. Kids are allowed to make mistakes. Kids make mistakes every day. Adults, we make mistakes all the time. And again, if I was judged upon one night, one event, it would be pretty tough, right? But if we can look at, and kids, by the way, are really good at defending themselves and rationalizing one night or one event. But like you said, you were talking through and identifying a couple events or a couple behaviors or a couple weekends. And I'm just curious, do you see a pattern created? And do you see these different events kind of culminating in a little concerning behavior? And that's where I'd like to have families really look out for, is not just one event, but a cumulative of different events around alcohol exposure. Going into the summer, adolescents are exposed to a lot of what they think they should live up to when it comes to social media. We used to be up against that myth from a party from last summer, or we used to be up against that myth from a party coming up this weekend. But now kids are up against that perfect image, college parties, summer parties, of what they think they should live up to. And that leads to FOMO, fear of missing out, with adolescents looking up to social media, looking up to older siblings, and thinking that's what they should look up to.
So, Mike, you mentioned that teenagers, they get to make mistakes. And one of the things that you'd mentioned as a tool in the past was something called the amnesty card. Can you talk a little bit about that?
Thank you. Yes, it's a little controversial, but I want to make sure I'm getting this first part across first. When I'm talking about the amnesty card, I'm talking about safety with your adolescent. Ultimately, we want our kids to feel safe, and ultimately, we want you as a parent to be the first go-to person your kid calls out to if they're in a place of need. And so when an adolescent is out at a party, at an event, or at a place where they don't feel comfortable, they had some exposure to a substance, they had some exposure to an alcohol, or if their friend or they're worried about their friend, we really want to instill that they're not going to get in trouble if they reach out to you. So I ultimately prep parents to have this conversation in preparation for events and exposures, that you're not going to get in trouble if you call me. And if you call me, I'm not going to ask you 20 questions. I really want to pick you up. Now, the challenge for parents is I really want to hold the parent accountable to say, can you pick your child up, not ask any questions, and just make sure your child is safe? That's critical. The amnesty card goes to that place of the Good Samaritan law. So many of our youth don't understand that if you're worried about someone's safety, if you're worried about someone's well-being, you have every right to call 911, bring someone to an emergency room, and you as a person will not get in trouble. There's a legal law that says if you're worried about someone's safety, there's no issue. You should never get in trouble. And that can be argued if you get in trouble by the law.
Yeah, we often say at Speak Up as a shortcut, lose a friendship, not a friend. Because what goes through a teenager's mind is, my friend is going to be so mad at me, or my friend is going to get in trouble. And so just as a shortcut, that's something that we have come to say, and people have found helpful.
That's huge. Lose a friendship, not a friend. If not you, who? If not now, when? And the power of an adolescent's words and not being afraid to say something if that kid is worried about their friend is huge.
Thank you. Mike, we talked about substance use and misuse. I know that you're an expert in dual diagnosis, but the interplay around mental health as well. We're seeing a lot of young people struggling with their mental health. Can you talk a little bit about that as a discrete thing, but then also as it relates to substance use?
Sure. Independently of substance use disorder, we're seeing a lot more anxiety, a lot more depression, and ADHD symptoms as well. So during the pandemic, when a lot of us were told we had to stay at home and appropriately, but what happened was then the pressure of coming back to normal, those first couple of years out of the pandemic, some of the kids were ready, some of the kids weren't. And so they're now seniors, were in 7th and 8th grade, missed those middle school years. Our critical years of development now are seniors in high school. And now they're facing colleges. So we're seeing a lot more anxiety and depression and motivation issues when it comes to youth and young adults seeking this next stage of life called college. Independent of substance use disorder, we're seeing a lot more numbers of mental health issues across the nation. However, when it comes to then certain youth are then turning and chasing an external to make their insides feel better. That's the definition of a process addiction. Let me say that again, chasing an external to make your insides feel better. They could chase with the external of social media, hours upon hours of social media, video games, chasing an external of body image, how they look on the outside, substance use disorder, alcohol. So kids are more susceptible to look outside themselves to make their insides feel better. There was a research that came out years ago, Treatment Research Institute at Penn, came out and said 87% of young adults that have a primary substance use disorder have a secondary mental health issue. NIDA, National Institute on Drug and Alcohol, came out and said 6 out of 10 adults with substance use disorder have a mental health issue. And NAMI, National Alliance for Mental Health, came out with their own research, said 6 out of 10 people with adults with mental health issues have a substance use disorder. So when we talk about what's called comorbidity or dual diagnosis, those terms are interchangeable. We're talking about an individual that struggles with both mental health and substance use disorder. And if we don't treat both, we don't get healthy treatment for both, then we're not going to heal from either. The old adage was we got to get the person sober and then work on their mental health issue. Well, what we've learned is that we have to talk to the individual and make sure they're getting healthy treatment for both their mental health issue and their substance use disorder. When we talk about mental health and substance use disorder treatment, one or two families keep asking me all the time, am I okay with medication management, for instance? And medication is great. There are medications out there that treat substance use disorder, which is fantastic. But just like ADHD or anxiety, medication alone isn't typically the protocol. So I sit at a 4-legged chair, and on 4 legs, one leg could be medication-assisted therapy or medication management for my mental health or substance use disorder. One leg could be talk therapy. One leg could be 12-step orientation. One leg could be exercise. So it's interchangeable for that person, and we want to think comprehensively in treatment of individuals that struggle with substance use disorder.
Thank you. One thing I heard you say that really stuck with me is it's never too early to have these conversations and it's never too late. Can you say more about that?
Adolescents are getting exposed to via social media and via, I think the number is 83% of our youth are getting exposed to substance use disorder on social media before they even see it in real life. So if we're talking about 4th graders, if we're talking about 5th graders having technology, having cell phones, having social media before they're having a conversation with their families. And so I tell parents every day, don't be afraid to have conversations with their child too early, especially in your family of origin, especially if you're a person in recovery, especially if you have some mental health acuity. Being able to share that with your youth in a vulnerable way, in a preventive way up front is so vital. But to have these micro conversations and these 15-minute burst conversations periodically through their life, I think is great. And it's never too late. When it comes to helping individuals get sober or helping individuals in having these conversations with young adults or adults, it's never too late to reevaluate and it's never too late to readjust. And I'm in the business to help people change. And therapists are in the business that change can happen at any time of life.
That's really helpful. And I think one of the things we say at Speak Up all the time is you do not have to do life perfectly. You do not have to do it alone, and it's not a straight line. And that part about it not being a straight line has been something that I think has been really helpful for parents and families to embrace that idea that,
it's not
there are detours.
Life. Yeah, exactly. It can be a curious line, but that line is really enjoyable, not alone, with somebody else, with some other perspective. I use that perspective all the time when it comes to today's technology. It's not all bad. We rely on technology like GPS, a little guidance to get us somewhere, right? My anxiety's decreased when I look at Waze and I'd see it's 5 minutes of traffic. That helps my anxiety decrease. So when it comes to guidance and perspective, our youth rely on GPSs every day. So I ask adolescents and families just to think about perspective. That's what a therapeutic perspective could be, a conversation could be, and a preventive talk could be, is just a little bit more perspective to navigate this road in this marathon.
Thank you. As we wrap up, I want to extend my sincere thanks to our guest, Mike Blanche, for sharing his wisdom and expertise with us today. Mike's proactive approach to prevention and his commitment to meeting the substance abuse and mental health challenges youth and families face is inspiring. Let's do a quick summary of some tips and takeaways. It's not about the talk, it's about the ongoing conversation. Be curious. That's the opposite of judgmental. Know your risk factors. We always say, shake your family tree. Develop the relationship so your teen will come to you if they are struggling. We are grateful to the Uncommon Individual Foundation for recording and producing this podcast. UIF is a mentoring nonprofit that powers ONTRACK Plus. And of course, we are thankful for you, our listeners. Visit speakup.org to learn more about our programs. If Speak Up is in your school, we are in 30 middle schools and high schools. We encourage you to experience it. You can also join us for one of our parenting adult coffees that cover the topics that teens want to talk about, that parents can learn about, and also our grandparent coffees, our youth mental health first aid training, and our QPR suicide prevention training. As we end every Speak Up, we want you to know that you don't have to do life perfectly, you don't have to do it alone, and it is not a straight line. We are constantly rerouting as we help our teens navigate the journey to adulthood. Give yourself some grace. You are already moving forward just by listening to this podcast. Remember to subscribe to the Speak Up podcast on Spotify, Apple Podcasts, Google Podcasts, or you can watch us on YouTube, which will be posted on the Speak Up website, speakup.org. Again, thank you, goodbye, and join us for our next episode of the Speak Up podcast.